This is a brief introduction to the new nursing programme for supervision and assessment of learning and practice for students. Nursing Midwifery Council, after consultation with patients, registered nurses, tutors, lecturers and students, came to the conclusion that they need to rethink what nursing of the future should be and what should be included in a programme leading to registration. They decided that there should be one set of proficiencies that apply to all fields of nursing, and that precise skills and procedures annex should be identified for learners. What they also decided is that all fields should have a basic understanding of each other's and caring for patients from different fields for mental health and physical care to be recognised, assessed and addressed, rather than having to refer or missing something. Increasing focus on public health issues and preparation for leadership roles and care to deliver care both inside acute and hospital care settings and across the community fit in with the NHS plan. What was also identified is there should be some theoretical underpinning knowledge understood on prescribing, so that when students qualify and go into clinical areas where prescribing is needed, they can commence their prescribing course. The other thing is that there is an expectation that students develop that greater sense of self-management, autonomy of their learning throughout the programme, is taking the lead and identifying what they need to do, when they need to do it, and how they're going to get there. So they introduced 7 platforms and 2 annexes. The platforms for nursing are, as you see the increase in promoting health and ill health. Also the leading and managing care and working in teams, and also the improvement of safety and quality of care is more prominent than perhaps before in a nursing course. The 2 annexes are around communication, relationship management skills, and then the second annex is around specific nursing procedures. What they want is for learners to demonstrate greater depth of knowledge in their chosen field, and more advanced skills, but also to have experience of caring for people across all fields. So here is our programme, and we've used the platforms to identify our modules, so you'll recognise those, and then skills and practice comes under providing and evaluating care, and then coordinating care for complex needs, and then transition to professional practice. Those are the skills practice elements of it. Depending on where people decide they want to step off, they can actually step off with an award. We're running a 3-year BSc nursing programme. We're also running an apprenticeship programme for BSc nursing, and we're also running programmes at level 7 for masters, for single field or for dual field registration, either adult and child, or adult and mental health, or child and mental health. Choice is up to the student. As you see, each year the needs are deeper and the identifying of different modules. So, as we said, shared modules across the first 2 years. Students will be studying alongside and sharing their experiences and their understanding of their specific field with other fields. In year 3, it becomes field specific, and in year 4, depending on what route people are taking, if they're taking a second field, registering a second field, then they would do 1 field in year 3 and 1 field in year 4. So students are required to develop that greater sense of self-management. So we need to enable students to be proactive, identifying their role within the team in the clinical environment. When I talk about we, I'm talking about practitioners as well as within theory. Having that responsibility for learning and recognising transferability of skills, and appreciate how you contribute to effective and safe and effective care. Also, to take responsibility of the assessment, we'll be able to planning assessment with assessors and making sure that the evidence they present to their assessors actually meets the requirements in order to pass. So students who are transitioning from one programme to the next will be familiar with the roles of mentor and sign-off mentor. However, the Nursing Midwifery Council has introduced new roles, that of the supervisor, the practice assessor and the academic assessor, and they will work together to support the student and contribute to the student's assessment process. Practice supervisor role and responsibilities. So practice supervisors are registrants, either nurses, a registered nursing associate, a registered midwife, or other health and social care professions registered as their professional regulator, the Health and Care Profession Council for Physiotherapy and Occupational Therapy, for example, and the General Medical Council for doctors. They have current knowledge and expertise to support learning within their scope of practice, their clinical area. They're to serve as role models and to provide feedback on progress and achievement to students, but also providing feedback to the practice assessor. So practice assessors' roles and responsibilities. Practice assessors are a registered nurse on the same part of the register as the student they're assessing. They conduct assessments to confirm achievement proficiency. They seek feedback and evidence to ensure that there is an objective evidence-based assessment of the student. Their current knowledge and expertise has to be maintained as well, and they're to link with academic assessors to review progress. There are recommended key milestones that they need to work alongside the student to inform their decision, but generally speaking, students will not work with practice assessors that often. They will gain a 360-degree review of the student's progress from the others that they work with and from the evidence that the students presents. If students aren't progressing well and need support on management and plans, then they must undertake the lead in setting that with a student alongside the academic assessor. So they work in partnership with the academic assessor to evaluate and recommend a student for progression from each part of the programme into the next year. And also if they need to raise concerns about the student, and also, as I said, manage a student in collaboration with the academic assessor who's not doing very well. And also they are responsible for making sure reasonable adjustments are applied within the practice setting. The academic assessor, so an academic assessor is a registered nurse with appropriate equivalent experience for the student's field of practice, working for a university. They will also provide tutor and academic assessor for a student, so pastoral care, and also fulfill the academic role. Making sure the students are evidence-based, they're timely done and they're robust. And making sure that assessments and confirmation of proficiency are based on the understanding of the student's achievement across theory and practice. So they will bring to the assessment process the student's academic achievements. They make sure that everything is confirmed and that decisions around proficiency to progress are made jointly with the practice assessor. And as I said before, to co-manage a student not making progress. So, when a student has a named academic assessor for each year, they have a different one each year, it's an NMC requirement. You will know, students, who your academic personal tutor is, and when you start a placement, you will have a practice assessor identified. They will do the initial planning, the halfway and final review with the student. That information is then available for second placement, subsequent placements for practice assessors to pick up and move on forward with the student. In placement, students will predominantly work with a variety of supervisors who provide the feedback and evidence as I've identified. At the end of the year, They make a joint decision together, academic assessor and practice assessor, on the student's eligibility to progress. The communication between all parties is via the student's electronic assessment tool, where academic assessors can monitor the progress of the students, and communications can take place through connection, linking in through emails. If it requires a placement visit from the academic assessor, then that will take place. Otherwise, communications between the student, the academic assessor and the practice assessor will be via email. So we said students need to gain skills in a range of care settings across the whole healthcare landscape. There are 2 placements each year between 8 and 10 weeks. There are 3 placement categories: inpatient, community and specialist. Now, specialist can be either in the community or it can be in an acute care setting. For example, in the community, it's specialist nursing teams, specialist nurses, like community matrons or specialist assertive outreach teams, or health visitors. And in the acute, it could be intensive care, ED, coronary care, neonate units, for example. And by the end of the programme, the student will have completed placements in these care settings. The other thing that will happen is a 3-week cross-field experience at the end of year 2. Students will be put either into areas where they will meet adults, children, people with mental health and learning disabilities, such as a minor injuries unit or a GP practice, or they will go into a placement that is different to their current field. So an adult student may go and spend some time with a health visitor or into a neonate unit. A mental health student may go into an adult outpatients or a child outpatients, for example. At the end of year 2, students will have an optional placement where they can choose to work anywhere within the UK or across the world. There is detailed information about that within the handbook and on our page on Poppy around optional placements. So, what are we expecting from our students? So year 1 is about development, participating in care, being supervised and learning alongside registrants. In year 2, it's that continuing to develop the practice within that team and demonstrating increased level of independence, beginning to implement care more readily and requiring less direct supervision. In years 3 or 4, students can be reasonably expected to plan and deliver care effectively, leading the team. Essentially, they will need to demonstrate that they can lead patient care and demonstrating that with less direct supervision. So our programme is divided into 3 parts. Those undertaking masters or dual registration will be assessed in both their chosen fields during their final 2 years. We have graded practice in the past, but we will be discontinuing that, and each element of the practice assessment will be pass or fail. There are clear guidelines in the assessment tool what requires a pass. A practice assessor, as I said, will be allocated at the commencement of the placement, and all students will have an initial, a midpoint and a final meeting with their practice assessor, which will be recorded in their assessment tool. So, the ongoing achievement record consists of this: introduction and orientation within the first week, those 3 interviews that I talked about with documented communication around those meetings. Each placement has a professional values assessment. There are episodes of care and medicines management assessments each year. We're expecting students to take service user and carer feedback to provide evidence of proficiency. There are the detailed proficiencies that we're going to look at in a moment. And all of this forms the student's ongoing achievement record. So the professional values assessed in every placement. This is the code: prioritising people, practising effectively, preserving safety, and promoting professionalism and trust. Required of every student is required to be demonstrated in each placement. As I said, part 1, 2 and 3, the assessment is meeting the proficiency around guided participation, active participation and independent. Students are required to be assessed by their practice assessor for holistic episodes of care. Each year there is a requirement, and students can choose whether they're going to be assessed in year 1 for 2 assessments, one being meeting an individual patient service user need and one being medicines management. Now there are 2 placements in the year, and the student with their academic practice assessor can choose when the assessment is a good timing and when it can be done, and what the requirements are. So you should be working towards this. So at the moment we're asking placements to identify which episodes of holistic care could be assessed in their clinical area. Placements are going to be identified a year ahead so students can plan the assessments they can take. So here for the medicines management example, here are the 5 criteria that students have to achieve. So part 2, in the second year, there is a medicines management administration for either a patient with complex long-term conditions or for a small group of patients. The other thing that takes place is 2 other assessments, and that's care of a patient service user with complex needs, or a group of patients. So if you're working in a ward environment, you could be looking after 3 patients, for example. Now, again, as you have 2 placements in a year, you could choose to do one in the first placement and one in the second placement, for example. And here again are the objectives and the outcomes that students are required to demonstrate. So in the final part, so as I said, if you're doing dual registration, you will be assessed on these in both fields. You're required again to do a medicines management assessment for a group of patients. You're also required to lead and coordinate care of a team for a group of patients. And the other assessment that is required is peer teaching and learning, and here again are the criteria for assessment. Example, supervising and teaching less experienced students and colleagues, appraising the quality of the care that they provide and providing them feedback. Demonstrate that understanding of what facilitates and impedes learning, and demonstrate leadership and the assessment and planning and implementation of care. Understanding of the knowledge and skills required to appraise the quality of nursing care, communication and interpersonal skills, and reflection on your own experience here at leading that team. These assessments will take pretty much a half a day. If you're in the community and you've got several visits to make, or you're leading a team, distributing them across the community care setting, or if you're in a ward environment, leading the team for a group of patients for the day. So, practice assessors must observe the episode of care on a set date and time that is agreed with the student. There are criteria that need to be observed, and the student needs to write a reflection as part of the assessment, and we've been looking at some of those criteria. Now, obviously, we understand that students will want to be making the most of their practice and their run up to their assessment, and probably would want to take it towards the end of the placement. However, if a student is ready, assessment can be conducted at any time, although we recommend not within the first 2 weeks of placement. They both need to agree the date and time and how long the assessment will take, and there are opportunities for rehearsal in practice. The student is required on the day to confirm that they are fit to proceed with the assessment. What we're saying is, if they can't they feel like I'm not doing very well, and say, well, actually my dog died or something last night, and that's why I'm not very well, and I all that sort of thing, you can the student can decide not to proceed if they're not well enough, but their assessment must take place before that placement is completed. However, you can also submit extenuating circumstances. Students who are referred who don't pass, or students who submit extenuating circumstances because they're unwell, will be required to take a retrieval placement of about 3 weeks at the end of the year before being able to progress. Proficiencies. So in addition to the episodes of care and the professional values and professional behaviour, students have required over the period of their programme, so 3 years for a degree, 4 years for masters, to demonstrate that they are proficient at the 90 proficiencies that the NMC have identified. Now, there is a associated booklet with this presentation, and they are detailed in there. They are divided between each year, and depends where the student is placed, depends on the opportunities for them to demonstrate proficiency. And as I've just said, we've asked clinical areas to identify which episodes of care could take place in their clinical environment. We're also asking them to identify which proficiencies can be identified so that students can look at to see the placement they're going to and see what can be achieved there. Now, students who have been assessed as proficient but don't continue to demonstrate that may have to have a reassessment, though that might take place. But the assessment of proficiency can be by practice supervisors or assessors or anyone who's occupationally competent, such as phlebotomists, for example, such as a doctor or a physiotherapist, if the proficiency is within their scope of practice. At the end of each placement, practice assessor will verify which proficiencies have been achieved. So it's an ongoing developmental, ongoing progress throughout your whole programme. So this is very short. Students will be made familiar with these when they are prepared for practice placements. This is an introduction. There is an associated booklet. Please see that. So I'm hoping that you feel better informed after listening to me, and please make reference to the workbook.